Welcome everybody and welcome back to Wellbeing Wednesday. And this week's topic, we're really looking at hypertension and our functional medicine take on managing hypertension. If you haven't yet checked out our blog post, please, I encourage you to do so. I'll put a link to it in the comment section below. And on Wellbeing Wednesday, we focus on physical activity because it's that important. It needs its own day. And when it comes to hypertension, it's particularly true. So in this segment, we're going to look at why I believe that physical activity can assist in managing hypertension as effectively as medication can. Right, so we know that aerobic exercise like brisk walking, running, cycling, swimming, these are great for heart health and they'll help lower blood pressure. But how do they actually do that? And so here's a couple of things to remember. Number one, your heart is a muscle. And like all muscles, when you exercise it, it becomes better, stronger. So if you've got a stronger muscle, it can eject more blood every time it beats, which means it lowers your resting heart rate, which is a good thing. The other mechanism is simple physics. When you exercise, your working muscles and organs need more blood. So they dilate, your body dilates your arteries. If you're putting the same amount of fluid down a pipe that's wider, the pressure in that pipe will reduce. So it's pretty simple physics. I wasn't great at physics at school, but those are just two ways in which physical activity can impact on blood pressure today. And that vasodilation effect lasts a couple of hours after your workout, so that pressure remains lower for at least a few hours after you finish your workout. Both of those mechanisms are a good thing. Let's talk about resistance training, strength training, and this includes activities like weightlifting, push-ups, squats, etc. And we know today that resistance exercise helps manage hypertension in a number of ways. The first one is building muscle. More muscle means increased metabolism. Muscles are very energy demanding, so the more muscle we have, the more arterial flow that we need to those muscles. If we have the same amount of fluid through a wider network, pressure comes down. So that's really important about strength training. It also improves this arterial stiffness that we get, making the pipes more pliable, and therefore lowering the blood pressure, lowering your pressure over time. So resistance training, very, very important part of any physical activity program to manage hypertension. Our physical activity also combats two of the really bad actors when it comes to chronic disease and hypertension as well, and that's chronic inflammation and insulin resistance. So chronic inflammation can damage blood vessels, while insulin resistance affects how our bodies process sugar. If we have consistently high sugar, we have consistently high blood pressure. Regular exercise reduces chronic inflammation by decreasing pro-inflammatory markers, improving your immune system, a number of ways. But it also enhances insulin sensitivity, which helps your body regulate blood sugar levels more effectively, leading to, over time, better blood pressure control. You might wonder, how can I say physical activity can be as effective as medication? So let's unpack it. Regular physical activity addresses the root causes of hypertension, like excess weight, stress, poor circulation, chronic inflammation, insulin resistance. It improves your overall cardiovascular health as well, without any of the potential side effects of medication. So for many people, consistent exercise can significantly reduce or even eliminate the need for antihypertensive drugs. So there you have it. Physical activity can be a game changer in managing hypertension. But please, this is not a dump your medication tomorrow and you go off to the gym. Please don't do that. Please check with your doctor or your functional medicine practitioner before starting out on any exercise routine, and particularly if you're going to change your medication. Stay healthy, stay happy. We'll see you all next Wellness Wednesday.